Welcome to another Tambay session. This is a vodcast brought to us by Friedrich Naumann Foundation. I am Miss Mela Habijan, your host. Ngayon naman pag-usapan natin kalusugan. And we are very fortunate to have with us a registered nurse who has volunteered and at the same time pursued a career in healthcare, providing assistance and hope to HIV, to people living with HIV or PLHIV na tinatawag natin. Let's all welcome Ron De Villena. Hi,
Hi!
Ron!
Thanks for having me.
Kamusta?
Okay naman.
Huwag ka mag-alala, kinakabahan din ako.
Oo nga.
Sabi niya kasi
Sorry.
sa akin, kinakabahan ako. Ako rin,
Super daming
kinakabahan.
beses. Thanks for having me
Yes.
again.
Thanks, Friedrich Naumann, for having us.
Thank you.
Diba? Magkakilala na tayo prior to this podcast and we know of each other as volunteers of Love Yourself. Why was it important for you to volunteer? Kailan nag-start yung spirit of volunteerism in terms of PLH, in terms of HIV advocacy?
It all started nung nagpa-test ako in a mass testing event. And then, I noticed na maraming tumutulong and one of them nga is a volunteer. So, he's a volunteer counselor and life coach. So, he assisted me and feeling ko yung vibe kasi during that time is very warm, ganon. Na parang everybody's welcome. Tas ang cool ng mga ginagawa nila. And walang bayad. Talagang gusto lang nilang mag happy-happy and tutulong sa iba. Which motivates me na, ay parang kaya ko rin namang gawin yung ginagawa niya. So, from there, nagtanong ako sa kanya after our session kung paano maging part ng isang organization and paano maging volunteer. And luckily, he assisted me naman and then I got in dun sa organization niya and I was able to help other people. And then, it grew from there. Nag-jump in din ako sa iba pang mga organizations, Gawad, Kalinga, and other NGOs.
Have you always been this um, person who wants to volunteer, even as a kid or as a student?
Oo, parang growing up, ako yung parang bida-bida. I may say, kapag merong may sakit, hala, anong nangyayari sa'yo? Hala, may kailangan kang gawin for a project. Sige, try nating mag-research. So, andun ako sa part na hindi naman ako tinatanong, pero gusto kong tumulong. And from there, nagdadagdag talaga yung mga tao na, sige, ako din, baka kailangan ko din ng tulong from you kahit hindi ka naman magtatanong. So, nagdadagdag talaga siya eh. And then, it create other people na, it creates na parang, ako din magbo-volunteer. So, in a way, nai-influence ko sila. And yun yung parang humbling for me na nakakatulong sa iba.
Nakakatulong sa iba. Very recurring.
Recurring.
Recurring sa values mo, yung pagtulong sa iba. And through the years that you've worked at the healthcare sector, especially with PLHIV, ano na yung napansin mo through the years? Meron bang pagbabago in terms of movement, in terms of testing, in terms of cases? Kamusta tayo ngayon?
Mhm. For now, I can't say in general kasi, but for the testing part, um, iba-iba yung efforts ng organization to reach those na mga hindi na nare-reach ng testing. So, available na yung self-care testing. They can even avail it sa mga platforms like kung ano-ano pa na market, 'di ba? And yung free information online, I think yun yung magandang reach for those na gustong matutunan yung anything about HIV. And treatment naman is always there. So, may mga organizations din na tuloy-tuloy yung bibigay ng serbisyo regardless kung malayo or malapit man. So, okay siya. Though may challenges, say for example, efforts of availability ng medication, hindi nakakarating sa iba. It's an ongoing, ano naman, problem, pero naitatawid. Oo, naitatawid naman siya. Um, Challenging lang talaga at first, pero kapag nagtulong-tulong, I guess, kapag ginising mo naman yung iba, a-action at a-action sila.
And now we're seeing progress little by little. In fact, our target is by 2030, 'di ba? Meron tayong 95, 95, 95, 'di ba? Bali, moving tayo dito sa progression na ito.
Correct.
And are you positive that we will be able to hit it by 2030?
By 2030, fairly, I would say, na ma-hit natin yun. As long as open yung mga tao to embrace yung HIV, embrace na hindi lang siya the old pandemic. May hit talaga natin siya. Just be open about the testing and the treatment and other prevention na meron available naman sa market. They can definitely hit it. You can definitely.
Marami sigurong nagtatanong ngayon, you're a registered nurse, why didn't you decide to pursue a career in the hospital? Bakit nandito tayo sa advocacy? Healthcare pa rin, pero specific to PLHIV.
Alam mo yung journey na yun, parang from the very beginning, kapag natapos ka ng nursing, all they know is maglaland ka to a hospital, to something else. Pero ako kasi, gusto kong ma-serve yung community ko. I'm proud member of the LGBTQIA+. But, gusto ko talagang maserbisyohan yun. And one way of doing that is through an organization. Hindi ko naman sinasabing limited yung scope or kapag nasa hospital ako. But I guess yung maliit na community o yung minority na community na yon yung madalas na hindi nabibigyan ng attention, and I want them to share some light about dun sa mga hindi nabibigyan ng attention. Yun.
Laging nakafocus doon sa pagtulong, and now, for our community, di ba? Specific to our community.
Correct.
Bakit hindi ka rin nag-ibang bansa?
Madami din nagtatanong yan, bakit hindi ako mga ibang bansa? Personal reason, family. I experience a lot of deaths in the family, and so natitira na lang yung nanay ko and also my sister. So lumiit yung family. So ayoko kasing pumunta sa ibang lugar na hindi sila kasama. Siguro ganun ka-close yung ties ko with my family na andito lang ako. And also, hindi ko nakikita yung sarili ko abroad pa. Well, i-open ko naman yung mga doors kung may possibility, pero mas gusto kong mag-serve ngayon sa Pinas. Oo, kasi hindi nga lahat umaalis na. Parang sinong matitira for our people. I also have my visions, I also have my dreams for myself, for my family, but definitely gusto ko din kasama yung ibang tao. Oo, through that. And yung community na pinaprotektahan ko.
Sabi mo nga, marami nang umaalis. And with the level of life that nurses face in the Philippines, masisisi ba natin sila?
Hindi natin sila masisisi eh. Kasi, nagtitiis. I guess yung word. Masyado ding siguro nabigyan ng parang nakasanayan na let's say, maliit yung sweldo. Yun kasi yung parang basis kung bakit aalis. No? To give a better future for their family and for themselves. But, the point is, alam natin eh, it's a given fact na maliit yung sweldo, but wala tayong ginagawang action. I mean, andun naman yung tools to help the community, the healthcare community to have good salary grade, yet parang kulang yung efforts na binibigay or support nga to ensure na lahat fairly nabibigyan. Yun.
If you had 3 wishes na pwedeng tuparin ni Genie ngayon for the healthcare sector or pwedeng specific to PLHIV, ano yung 3 wishes na yon na sana matugunan ng gobyerno?
Number 1, better pay grade for all the healthcare workers. Not limited to the nurses, the doctors. Kasi hindi lang din sila nagsasalita siguro, maybe. But they can feel na maliit. Hindi sapat for the life na meron tayo ngayon, lalo na lahat tumataas. Salary. So number 2, cure for all illnesses siguro. Si Jeannie naman yan. So feeling ko kaya niya yan. And then number 3, siguro a better management for the country.
A better management for the country, cure for all, and better salaries for nurses. 'Di ba? And these are great things so that we can improve lives. Kasi yun naman yung goal ng nurses, 'di ba? To be able to improve lives. And I am with you in those wishes. How can we help you so that these things won't be wishes anymore?
In a way, for clients or for other citizen, yung support na sana mabigyan ng karampatan na sweldo, lahat ng healthcare workers, yung support lang na yun, enough na yun eh. It might be a little kasi maliit yung voice natin for that, pero the moment na ma-feel namin na andun yung support na ay sila din, nag-wish sila for us na tumaas yung sweldo, I guess that's something for us na mag-push through at ipaglaban pa yun. Though naiintindihan ko na may mga limitations, may mga reasons bakit hindi pa siya nangyayari, may mga kino-consider. Pero kung kaya naman nung iba, I guess, pwede naman din natin siyang gawin dito.
Now, as a healthcare worker who's caring for PLHIV, let's debunk some myths. Diba? Para at least kahit papaano ay nakakatulong tayo in the advocacy. What are the top 3 myths that we want to debunk about PLHIV?
Ako i-underline ko agad yung power nung undetectability. So, HIV is treatable and manageable. So, parang during the time kasi ang idea natin about HIV, hala, wala na yan, ikakamatay na yan. Pero hindi. Once ma-diagnose yung isang tao, pwede siya mag-treatment and it gets well to the point na magiging undetectable siya. Yung term na undetectable, that means untransmittable or hindi na siya passable to anyone. Ganun din ka-powerful siya kasi zero transmission. I know people or I have clients din na they were able to start their own families, nagkaroon ng baby, tas hindi nga siya nata-transfer to the mom and dun sa baby. So, ganun ka-powerful yung mag-yes ka dun sa treatment once you get diagnosed. So, number 2, sexually transmitted kasi siya at hindi siya passable kung saan-saan lang. There are people kasi na parang pag wala pa silang knowledge about it, hala, bawal i-kiss, bawal i-hug. Definitely not. Oo. Sexually
Yung
transmitted.
iba ayaw pa makipag-share ng baso.
Totoo.
Oo.
Totoo yan. So parang hindi yun kakulangan sa pagkatao mo kapag ginawa mo siya. So definitely, kung undetectable nga yung isang tao, definitely hindi yun mapapasa sa iba. So, and then number 3, I would say na preventable din siya. Oo. May mga bagong tuklas na din like yung PrEP or yung pre-exposure prophylaxis and also PEP. In a way, hindi lang yung old forms or yung conventional way of protecting yourself like condoms and lubricants yung nag-end, but also yung PrEP. Yung power ng pill na yun to protect yourself against HIV. I guess
And
those
those
are
are
the
beneficial facts na dapat nating tandaan
tandaan.
because right now in this day and age, there is cure.
There is.
Diba? There is cure at the moment and we thank our forefathers. Diba? Kasi before, ano siya parusa.
True.
Diba? So I feel for our forefathers and foremothers who experienced yung stigma
Mhm.
at makakatulong na bawasan natin yung or sugpuin natin yung stigma
Right.
if we continue to educate and make people aware
Correct.
of what HIV is and how we can prevent it and help it towards the 95-95-95 goal by 2030. Ako siguro, isa sa mga gusto kong i-debunk is hindi po ito sakit exclusive to LGBTQ+.
Right.
Tama,
Correct.
Ron?
Correct. It's paano ba? Anyone can have it. Oo, hindi siya limited to a certain group, whether regardless of your gender. Meron ngang mga bata. So definitely hindi lang siya talaga limited to a certain group. So ang importante dito is mawala yung stigma and discrimination whenever someone gets diagnosed and do your fair share siguro to debunk yung mga information na mali. And ingatan din yung sarili kasi self-care pa din siya
Yes.
at the end of the day.
Importante yung salitang self-care kasi self-care begins with a sense of responsibility.
Responsibility.
'Di ba? Kapag iniingatan mo ang iyong sarili, hindi ka pumapayag na malagay sa alanganin ang buhay mo.
Correct.
More importantly, pag iniingatan mo ang sarili mo, iniingatan mo rin ang iba.
Yun ba?
'Di ba? You become responsible for your actions. We have seen a rise in cases. I've heard of a news item na sinabing tumaas muli. Yung iba na alarma. Dapat ba tayong maalarma na tumataas yung kaso ng HIV sa Pilipinas?
It is alarming in a way, pero what we need to do is to respond properly. How? By educating other people. May responsibility ka na the moment na matutunan mo na paano siya nata-transmit and ano yung mga information na dapat alam mo. So preventing it would be a good tool para hindi rin mapasa yung anxiety sa ibang tao. And mas ma-share pa nila yung knowledge na yun to others.
It is alarming in one sense.
It is.
But also at the same time, the data that we have now
Mhm.
will also aid us to respond better.
Correct.
Nowadays, it's 2023. Mahirap bang maging healthcare worker sa Pilipinas?
Yes, definitely. Circle back ako dun sa una kong sinabi which is yung salary. Kasi nga, hindi naman siya natatapatan, kumbaga. That's why others decide to go abroad and maghanap ng sarili nilang plans doon. Ano. But, iba pag sarili mong bahay. Iba pag sarili mong bansa. Yun siguro yung ang hirap iwan because tayo nga ini-import tayo na pumunta doon para doon sa service na binibigay natin. So bakit hindi natin ibigay yun dito? Wherein mas makakatulong tayo kasi bahay natin to. Dito tayo nagsimula. Definitely, sana dito rin tayo matapos. Yun lang naman yung POV ko about it. But definitely, anyone, if they feel free to go and, alam mo yun, maghanap ng sarili nilang journey sa ibang bansa, so be it. May freedom naman tayo lahat.
But never forget about your home. Never forget
Your
about where
roots.
you came from.
Correct.
Kasi ang ating pinagmulan ang simula ng ating kasaysayan.
I love it.
Yes. Ano ang masasabi mo sa mga batang gustong mag-nurse? Go!
Yes, definitely dapat mag-nurse kayo. Bakit? Um, Alam mo, nakita ko lang din 'tong trend na 'to kasi bumaba din yung parang gustong mag-nursing, during and after, puwede na pa natin sabihing after the pandemic, bumaba din yung number ng gustong mag-nursing. So, parang in a way, nakikita ko siya as stepping stone para gumanda yung buhay once matapos nila yung nursing, mangingibang bansa sila. Pero it's a job wherein you can touch others people's lives, di ba? So, ganun ka-importante na hindi mo lang to gagawin for yourself, but also for your family na gusto mo ding tulungan and yung community na gusto mong ingatan.
Maraming salamat, Nurse Ron.
Thank you.
Nurse Ron, salamat sa pagpapahiram ng oras. And I know that you will be a builder of a better Philippines.
Wow, thank you.
Maraming salamat. Para sa lahat ng mga nakikinig, um, ang puso ng isang nurse, as we call them, ay nakaangkla or it is anchored with the spirit of care. And that's very important in our healthcare industry. Because if you have caring people, you are living by the spirit of hope. And I guess nurses are called the hearts of the hospital because they keep the heart beating because of hope. Hanggang sa muling pagtambay.